Hello, I'm Valerie Worthy, and thank you for tuning in. I'm a registered nurse and a 23-year breast cancer survivor. Today, I want to talk to you about self-breast awareness, and this is formally known as our self-breast exams. What we've come to understand is that you cannot talk about changes if you're not aware of your breast. Women beginning at the age of 40 should have mammograms. Now, if you can't afford a mammogram, I ask that you contact your local health department and they will assist you in getting a free mammogram or a low-cost mammogram. Beginning at the age of 20, a woman should begin clinical breast exams, and this would be by her primary doctor or GYN. Women should check their breast monthly. Now, if you're still having a period, you want to wait at least 5 or 6 days after your cycle. If you're not having a period at all, just choose a date and stick by that date. And try as much as possible to do it around the same time every time. What we want you to do is just to remain consistent. What we do know is that in doing just these things, you're more aware of your breast. So let's talk a little bit about self-breast awareness. So if you're in the shower, that is a really, really good place to be able to touch your skin and to be able to, your fingers smoothly go over your breast. So if you take your 3 pads of your finger, and if you go over your breast in circular motions, and we also recommend that you use like a quarter-size circular motion, and if you imagine that your breast is a clock, so we're starting at 12, and we'll work our way down in circular motions. Another thing that you need to do is your light presses, your medium presses, and then a little bit deeper. So now we're at 12, and then we go down to our 1. And you continue this all the way down to the center and around your breast. The other thing that women often forget is the nipple. So you want to squeeze it a little bit and see if you have any type of drainage. And then also, again, with your pressure around and behind the nipple, just to make sure that you're not feeling anything there. Now, another place that we'd like to have women to do is get in front of a mirror. You know, we always have in front of a mirror when we have clothes on, but this time we're asking you waist up, no clothes, and just look at your breast. So your hands are down and then they're on your waist, and you're looking carefully. You're looking at skin. You're looking to see if there's any redness, if there's a rash, if there's any dimpling. Are your nipples inverted? Those could be signs that there is something going on, and we're not saying that it's cancer, but it's something that your doctor should investigate. Again, when you're checking your breast, we want to make sure that you start from your cleavage all the way under your arms, because there are people that have found small tumors under their arm. And we're also asking you to start at your collarbone because your breast tissue is there as well. Again, we ask you to look for any dimpling, puckering, any kind of changes. And that's why it is so important that you check your breast every month. And the final way that you can check your breast is by lying down. The breast tissue spreads evenly along the chest wall when you're lying down. Place a pillow under your right shoulder if you're going to check your right breast, and you will use your left hand to check your breast. Again, as we discussed earlier, you will use your 3 fingers and the pads of your finger to check your breast. This is light, medium, and deep pressure. Also remember to squeeze your nipple. You're checking for any discharge. And again, checking underneath your nipple, light pressure, medium pressure, and firm pressure to see if there are any lumps there. Remember to be consistent with checking your breast, and early detection saves lives. It is so important that you understand this as well. It is a package deal. You can't do a self-breast exam and then you don't get a mammogram. You can't not talk to your primary or GYN about clinical breast exams. If you think about getting a mammogram once a year, but then you never check your breast, There's a lot of things that could happen within 12 months. So remember, early detection does save lives. And for African American women, we are disproportionately affected by breast cancer. While more white women are diagnosed, more African American women are affected. We die of breast cancer. So check your breast, do all that we talked about, and not only yourself, but share this with your friends, your family, your coworkers. Again, early detection saves lives.